All right, everybody, this is a very special day. He doesn't like it when I call him this, but we have a true celebrity in the house. You hate that word, don't you? Yeah, you're a celebrity type. This is a legit celebrity, especially in the realm of hyperbaric oxygen therapy. We have Dr. Jason Saunders with us today, down for the holidays visiting, and just worked out so well for him to come in. And I owe him a lot because this is the man that got me into hyperbaric oxygen therapy for both personal health issues with my family and now just starting to use it in the office. And we've been blown away by the results we're seeing very, very early on. So how I came across Dr. Jason is I'd seen the company that he uses, the Viteris machine, and the other chambers that are out there that are great that he can tell you more about. And I always knew I wanted to come back to it. I kept seeing it pop up on this website and this website. And finally, you have to be beat over the head sometimes with things before it really sinks in. I was going to teach a seminar in New Jersey, and on the way up there, I was listening to Ben Greenfield, the famous athletic performance, nutrition, lots of great modalities he uses for biohacking. And I listened to his interview with Dr. Saunders, and it just clicked, like, this is something I've got to be utilizing. And, it was one of those really life-changing moments, but I had to get even extra confirmation because when I landed to do my seminar in New Jersey, our mutual friend, Krista, who's an RN, she texted me and said, "Where are you at?" And I said, "New Jersey." And she said, "You've got to go visit my friend, Dr. Jason Saunders." And I was like, all right, I get it. I'm supposed to use hyperbaric. I get it.
Fine, I'll do it.
So thank you so much for coming by. And you have a very powerful story about how you got into HBOT. And if you want to share with everybody that, I think it's really great for them to know.
So this is, 13 years ago or so, but I'm a chiropractor, and we were practicing with my wife, Melissa, and, we had a small practice in New Jersey. And at the time, I had decided that I was going to put a new roof on my house, so by myself, with a hammer. So I'm like going up and down a ladder, I'm putting new shingles on this roof. We were going to flip the house in one day kind of thing. And I actually blew a disc in my back carrying shingles up a ladder. And, listen, at the time, I told you, I'm an AK doc. We use standard process. I know nutrition. I know to get adjusted. So, I'm getting worked on pretty regularly, probably 3-4 times a week. I'm doing good nutrition in terms of my food. I'm taking all the supplements, trying to get the inflammation down. My back issues got better probably within 2 or 3 weeks max, and I was back to seeing patients, but I was left with a right-sided drop foot. And a year passes, no change in terms of the neuropathy. A year and a half goes by, no change in the neuropathy. And I'm at a conference, I think it was in Vegas, and they had these chambers there. I had no idea what it was at the time, and it just looked cool. I'm like, oh, that looks like a spaceship. What is that thing? So I asked the guy who was doing sessions. I say, hey, can I go in there to do a sample session? So I go in. I'm in there only maybe 20 minutes, and I get out. I was like, okay, that was interesting. And I start walking around the rest of the venue, and I start getting like pins and needles in my foot, and I hadn't felt my foot in about 18 months at that point. And all of a sudden, I was like, wait, am I feeling that in my foot because of that thing I just did? I had no idea. I knew nothing about it at the time. So I go back, I talk to the guy. Of course, he's like, oh yeah, for sure. That was, I'm like, yeah, you just want to sell me a machine. So anyway, he agrees to treat me. So we go through in 20-minute increments. I did about 4 or 5 hours over the span of like 4 days. And I had about, 15, 20% recovery at that point. So I was amazed because nothing else I had done at that time, even touched the neuropathy. So I ended up buying a machine and then, treating myself over the course of a few months, and then had, complete resolution of that neuropathy. From there, more family stories. And that's the case. That's the case, I think, for acupuncturists in general, chiropractors in general. When you do nutrition, it's kind of like you had some kind of personal journey, a personal experience that we went through that said, hey, you need to think about maybe even incorporating this in your life or becoming this person or doing these kinds of therapies.
These patients think we got into it for them. It's for us.
Yeah, it's usually for us. And then it's like,
and then you benefit
share,
eventually.
Right?
Yeah.
So my stepdad I was telling you about, so he has MS, and he was diagnosed. I've been treating him now for over 13 years with hyperbaric. Before that, we were treating him with nutrition and chiropractic, and he was diagnosed about a decade before that. So he had already had about 10 or 12 years of degeneration, and then we've been on this regeneration pathway for the last 12 or 13 years, and he's done amazingly well. Our next patient was a family friend who had a stroke about 10 years prior, had lost vision. All she really wanted to do was drive her car and read a book. You know, we got her license back, and she started reading books again. So all of a sudden, I was like, wow, this thing is pretty amazing. I don't understand it yet, but clearly there's a benefit here that we need to look into. And that's when I really started getting into the research and trying to figure it out.
So he's so modest, I'm going to have to tell you for him, and I told you this in the hallway today, you really have the best, our camera got fuzzy there, but our audio is still on.
All right.
The best YouTube channel for all things hyperbaric oxygen. HBOT USA is the YouTube channel, correct? And the website is HBOTUSA.com. But that has been so instrumental for me with all the research, the latest research. Every single week there's a new video coming out. What the heck happened to my camera? What is this? Oh, look at that. He knows how to fix just by touching.
All right.
Is there anything this man can't do? So the HBOT USA YouTube channel, HBOTUSA.com, if you want to really dig deep into the reference studies, that are coming out all the time, and would you say there's a big resurgence in hyperbaric oxygen studies?
There were all kinds of pushback 13 years ago. We say, well, hey, we're doing hyperbaric and we're using it for this, that, or the other. Oh, there's no research on this. And 13 years ago, there was, but it was limited. And that research has increased a lot. I'd say in the last 5 years, but really in the last 2, exponentially. Like every month or 2, there's a couple good studies coming out on different topics related to hyperbaric.
So if you want to stay on top of that research, you're interested in this like me. I was looking at it. I was looking at it way too long for like 5 years before I jumped in. But if you're ready to jump in on the research, follow him on YouTube. Check out his website, because there's nobody that's doing a better job of simplifying the research that comes out. These big mega studies, to sift through all those and put them in bite-sized pieces. And every week I learn something new about this therapy. So my family story is my dad was diagnosed with Parkinson several years ago. And this has been, along with the PMF, just such a powerful therapy that he notices improvement with right away. And we were talking that all these neurological diseases have oxygenation issues at their core with, poor vascular, blood flow. And so every time he's in the chamber right now as we speak, every time he gets out, he has more energy, he walks better, stands up straighter. So thank you so much, just from a family, helping out family standpoint. Yeah. But what we've seen, and I haven't told you this yet, but just with the very, very short time we've had it in, one of the most consistent feedback results we've been getting is improved vision after getting out of the chamber, especially people with neurological problems. Yeah. And it hasn't been that many treatments. After 2 or 3 treatments, like I just see clear right when they get out of the chamber. So any thoughts on that?
Yeah, the thing is, and I'm sure you guys know this too, most of these chronic illnesses, which is really the biggest pandemic going on right now, is chronic illness. And they show up in so many different varieties across the board, and it kind of depends like what our weaknesses are. Our weaknesses are, brain and neurologic. Our weakness is, intestinal, or immune system. So whether it's an autoimmune issue, it's cancer, it's, neurodegenerative. These are chronic illnesses that are a consequence of, let's say, chronic illness or chronic inflammation, and they're all mitochondrial diseases. Right, so the mitochondria makes the ATP. It makes all the energy for all of our cells, and different tissue will degenerate at different paces. And these are all ways. And when you really look at, there's a lecture that I do, I love, that talks about mitochondrial function. And the summary is really, how many different ways can we influence the mitochondria? It starts with what we put in our mouth, and so our diet will dramatically affect. Is it, basically, are we running on sugar or are we running on fat? Like what's our fuel source? And then how many different places can we intervene along the way? Where can we clear out some inflammation? What supplements can we use to help deal with some of that? Can we charge our batteries better? Can we add the oxygen? All of these are, when you understand that whole cycle, these are all very specific interactions with mitochondrial function and how we can improve the ATP performance. Yeah. If the ATP goes up in any cell or resting cell membrane, which is part of that process, like through PMF, anywhere that you can actually improve cellular ATP production, you will see an increase in performance of that tissue. And there are certain modalities, particularly, let's say, nutrition or PMF or oxygen, where we can't be specific. I can't say, well, I'm only going to give it to the liver, I'm only going to give it to the intestine, I'm only going to give it to the brain. We're giving it systemically.
That's what I love about it.
And the eyes happen to be also, just like the brain we were talking about earlier, eyes are enormously metabolically active, right? So all of a sudden you're just like dousing them with all this extra oxygen, and they're creating that, they have that fuel now, they can create the energy source from that. So that's one of the reasons that we see that kind of thing.
So just with all the thousands of treatments you've run with this, in your practice, talking to doctors all across the country, what cases, talking to, the chiropractor, or any naturally minded medicine professional out there, what type of health cases would you say you have to use hyperbaric oxygen if you really want to, make a difference with these types of cases?
So I was saying earlier that at one point in our practice, it was kind of the last resort, right? So we all know this, that patients seem to come to us as a last resort, and then I was using hyperbaric as my last resort in that process. And the more we used it, and these tougher and tougher cases, I mean, that's kind of what happens to all of us, is as we get better at what we do, our patients who are coming in seem to present larger challenges for us. And so, we would do our standard of care. If they got better, that was great. And if they didn't, we always had this sort of backup of, hyperbaric. And then, but we were getting great results. So I was like, wait, why are we waiting until the end to first use something like this? Maybe we should move it up. And so we started moving it slowly up in the course of care until eventually, for some of the more complex cases, it's like, wait, why don't we just start with this? This is oxygen. Every cell needs it to upregulate the oxygen in their body to improve a healing response. Right now they might need 10 supplements and 6 months of chiropractic or something like this. If I do this first and I get some kind of improvement, maybe they only need 3 supplements and 3 weeks of each. You never know how it's going to play out, but generally speaking, I look for underlying, I think all of us do, we look for patterns, and we look for causes, and we look for what ingredient could we add to this person that might just start to stabilize, 5 or 6 or 7 of these different symptom patterns that they're having, so that their priorities really start to show up.
And it turns out oxygen is pretty important.
It turns out oxygen happens to be one of those things, and there's really no other way. I mean, honestly, that's the whole thing. We're all basically 100%, almost 98% saturated with oxygen. There's really no other tool that creates a surplus, like a reservoir of excess oxygen right now. That's really it. Hyperbaric is the only option there. So when you expose people over a period of time to create that reservoir of oxygen, and the body recognizes that there's this surplus, it just changes the regulation, the cell signaling that the body has. And so all of a sudden you get this upregulation, let's sort of say, of mitochondrial performance. Then you get an upregulation of mitochondrial density. Your body will literally create more mitochondria to support that level of oxygen. So in some cases, certain issues, let's say you have 50% mitochondrial efficiency, by doing all the things that we do, including hyperbaric and others, maybe we'll get 70% performance out of that mitochondria. But if we then doubled the amount of mitochondria you have, even if they're only at 70%, but you have twice as many, the amount of ATP production that cell can now accommodate to do whatever job it needs to do is enormously higher. So, those pieces are so critical. To get back to your question in terms of like what cases, as a chiropractor, back when we saw a lot of musculoskeletal cases, and we almost never used it because all the traditional modalities that we would bring them through others, whether it's adjustments or muscle work or even through the nutrition, we typically got people better just using that. But now we do. We add that in as just a faster way to get the inflammation under control, to spark that healing response.
To make everything else easier, every other therapy work more
effectively.
And
this too, it's not only as we get better at what we do, I think, do the people who come to us get a little bit more complicated, but also the world is more complicated, and these cases are just getting tougher. Like the things I did a decade ago or more, 15 years ago, to help somebody, people don't respond the same way that they used to. And so figuring out these other modalities seems to be, including things like PMF, red light, we do a lot of different modalities, compression therapy, like all different things because it just seems like, whereas I maybe got away with 1 or 2 therapies at one point, now takes 5 or 6 for that exact same case, or what it seems to be that same case. So the synergy, and that's the other thing, is the synergy between these different pieces. And when you understand the synergy, and where they fit, like we were talking about, like which order should it be, this first
Yeah.
or that first, those kinds of things. When you understand that synergy and how they interact in the cell, to fix the cell, right, to heal a single cell is really ultimately to heal the organism at the end of the day. And so when we combine different therapies that we're already using, but we do it in the right order, in the right amount, at the right time, in their sequence, those results seem to get.
So I just got to piggyback on that with the synergy of therapies. Like as a standard process practitioner, I'm having a blast with the synergy of, brain-based therapies and the hyperbaric oxygen. As a PMF practitioner, it's just phenomenal. Like you said, the more of these things that combine, and we have electromagnetic deficiencies today that we need PMF for. We have a lot of nutritional deficiencies, but we're just not getting the oxygen levels we need because we've damaged our cardiovascular system so much with our, refined modern American diet. 100 million Americans pre-diabetic or diabetic now, and that affects blood flow everywhere, especially to the brain.
I mean, I think that's the important point to go with that. Anytime there's damage, that damage could be trauma, like my issue from the roof, right? So like that was a traumatic experience, or it could be inflammatory, let's say, which comes from a variety, but probably toxicity and other chemicals and things in our environment. Anytime there's damage to an area, there's damage to the blood flow, right? It's the microcirculation. It's the microcirculation that's in charge of delivering nutrients, whether that's oxygen, let's say, from that you're breathing or from hyperbaric, or if it's nutrients from different supplements or even the food that we're eating. If there's damage to the microcirculation, we're gonna have a hard time getting nutrients into the system, and we're gonna have a hard time getting waste products away from the system. And now you're just basically bathing in a pool of your own inflammation, your own cellular debris and inflammation. So those are the kinds of people that we're seeing. We're seeing, whether it's they were already, let's say, toxic from these certain poor food choices, the certain job that they had, other environmental things that they maybe didn't have, exact control over. And then they finally got this injury that sort of threw them over the hump. And now they're just inflamed, chronically and acutely inflamed. And it's like the simple solution of a good adjustment or, some acupuncture, which, a decade ago I think would have helped those people tremendously. It still helps a lot. But I'm just finding that
desperate times call for desperate measures.
Yeah. So like you said, I mean, getting the resting membrane potential of a cell back up to the point that it needs to, balancing the electromagnetic fields of our body, dumping in this excess oxygen into their system so that we can finally get some of that fuel, healing that microcirculation is ultimately what's going to allow the healing of the organism over time to actually occur.
I don't know about you, but my brain is blown. I'm going to watch this 3 times just to get on.
But yeah, I think that's really, that's such a big piece of currently, I think, as a person in practice treating patients today, thinking about it a little bit more three-dimensionally that way is important.
Well, I could just listen to you go on about the benefits of this, and I have hours and hours. It would probably creep you out how many hours I've spent watching your YouTube videos. But I just wanted everybody to get a taste of what you have to offer, and I can't thank you enough for,
just to piggyback on that. So if you guys are interested and you take a look at some of those videos, I mean, that's why we're putting them out. We're putting them out because I do think this is an important topic, and I think that it's a place that's lacking a single source of information. So I look at my job right now as, going through all of those papers, doing all those research, and trying to disseminate that into some simple form. We're really focused on trying to improve access to tools like that, right? So if I could help a patient understand something so that they either seek it out or get their own equipment, or if I could help a doctor understand how easy it is to use and implement in their office, and now I know that person's now treating hundreds of families, then I feel like I did my job. So, we're creating this content, and we're doing this education and training because we want people to have easy access to something that's that meaningful to their practice in terms of even just the economics of being in practice, but also in terms of the results that we're getting from treating patients. And so
HBOTUSA.com. HBOT USA is the YouTube channel. Dr. Jason, thank you so much. This has really been amazing, and thank you. Keep up the good work.
Appreciate it.
It is the best YouTube channel, the best website, and the best resource for all things hyperbaric oxygen. Thank you, sir.
Thank you. Take care.